Good morning, everybody. My name is Alissa Heydari. I'm the Deputy Director of the Institute for Innovation in Prosecution at John Jay College. The IIP provides a collaborative national platform that brings together prosecutors, policy experts, and the communities they serve to promote data-driven strategies, cutting-edge scholarship, and innovative thinking in prosecution. Today, I'm honored to host a panel of experts to talk about the intersection of public health and the criminal legal system. At first glance, the two fields might seem completely separate, but if the pandemic has taught us anything, it's that what happens in one aspect of our society greatly influences the others. All realms of our community are really deeply connected, and prosecutors can learn a lot from those in the public health field about how to better address social problems. So an example is prosecutors have started adopting strategies to identify the most at-risk people who come through the system and connect them to services rather than relying solely on punishment and incarceration in every single case. If we want meaningful decarceration, prosecutors are going to have to need new models for how to respond to crime, and that's what we will be discussing today. So I'd like to introduce our panelists. In the interest of time, I shortened their bios a little bit, but as I'm sure you'll be able to tell from these brief summaries, if you're not familiar with their work already, all three of them are greatly accomplished people, and I'm honored to be doing this panel with them today. I should mention that DA Rachel Rollins from Suffolk County had planned on participating today, but unfortunately, due to a last-minute scheduling conflict, she is unable to attend. She sends her apologies, but I anticipate this is going to be a really great conversation regardless. I'd first like you all to meet DA Sherry Boston, who stands among the elite in the world of prosecution as one of the rare 1% of African-American women currently serving as district attorney nationwide. She assumed the role of DA for the Stone Mountain Judicial District in January of 2017. In her capacity, DA Boston oversees the prosecution of felony offenses filed in the Superior Court of DeKalb County and supervises a staff of more than 200 people, including attorneys, investigators, paralegals, victim witness advocates, and administrative professionals assigned to various divisions. DA Boston has become an integral part of the national dialogue on criminal justice reform and innovative prosecution strategies specific to juvenile justice, reentry, and accountability initiatives. Andre Ward is the Associate Vice President of the David Rothenberg Center for Public Policy, where he oversees Fortune Society's advocacy efforts to reduce reliance on incarceration, promote model programming for incarcerated people, change laws and policies that create barriers for successful reintegration, and foster a just and equitable criminal justice system. As a member of Fortune Society's executive team, Mr. Ward also helps steer overall agency operations. He previously served as Director of Programs at Common Justice, an organization that develops and advances transformative solutions to violence and fosters racial equity without relying on incarceration. At the Osborne Association, a policy advocacy and direct service organization dedicated to transforming the criminal justice system, Mr. Ward held numerous positions over the course of 6 years, including Director of Workforce Development at the Osborne Association. We also have Dr. Daliah Heller, whose research interests include urban health policy, criminal justice, community-oriented healthcare, and drug use epidemiology and interventions. She served as an assistant commissioner for the Bureau of Alcohol and Drug Use Prevention, Care, and Treatment at the New York City Department of Health and Mental Hygiene, and earlier as director of harm reduction in the department's Bureau of HIV and AIDS Prevention and Control. Before joining government, she built and led one of the country's leading harm reduction service organizations based in the South Bronx. Dr. Heller's implementation science experience focuses on drug policy alignment and coordination across municipal government agencies, substance use services integration into general health care, and practice improvement for criminal justice responses to drug use. She is currently the Director of Drug Use Initiatives at Vital Strategies. I should mention that we at the IIP were working with DA Boston, Mr. Ward, Dr. Heller on a new public health initiative related to drug prosecutions. I can tell you based on the conversations we've had over the last few months, They all have great insight in this field based on the conversations we've had. And so I'm sure today's going to be a wonderful conversation as well. I have a list of questions that I plan on asking the panelists, but if anybody has Q&A that they want to throw out there, please type it in the chat and I will try to get to them in the very limited amount of time that we have this morning. So with that, DA Boston, the first question is for you. When we talk about the criminal legal system becoming the backstop to so many of our social problems, can you give us an overview of what types of issues you think fall into that category and really how we as a society ended up in this position?
So thank you so much for having me here. And I think there are a lot of issues that fall into this category. The natural ones we think about are drug and alcohol abuse and mental health issues, but some that can easily get overlooked are homelessness, poverty, underemployed, food insecurity, and then obviously domestic violence, violence in the home, and then frankly, children being treated criminally as adults, disciplinary actions and behaviors being moved out of the school system into the criminal justice system. And those are all kinds of social dynamics that have made their way into the criminal justice system. And we have to start really talking about how we got here. And I liken it to a doctor. A doctor can always treat our symptoms, but if we don't actually address the disease, if we don't get rid of the disease, then we're still going to be suffering. We're still going to be sick. It's still going to come back. And that's the same thing goes to the criminal justice system. If we are just using the system as a case processing mechanism, like dealing with this case and that case, and not diving into the underlying issues of the why. How did this person find their way into the system? What is the underlying issue? And with many of these types of sort of social ills, if we address the underlying, educational issue, health issue, substance use disorder issue, then those people will not be re-engaging in the criminal justice system. And not only is that good for the criminal justice system, it's excellent for the community because we have helped resolve a problem that is systemic in a family, in a community, in a neighborhood, and help to re-divert the person into healthy living, which is what I think we all strive for.
Could you, following up on that, DA Boston, maybe talk a little bit about the work that your office has done to try to promote this change in thinking of your role in your community?
Absolutely. So when I became DA, I started our several programs under the umbrella of our DCAP unit, which stands for Diversion and Community Alternatives Programming. And that unit is really aimed at looking at all of the types of ways that we can be engaged with alternatives to criminal prosecution. And some of those things are things that we are participants in, like accountability courts that in my jurisdiction are judicially run. And then some programs are created that we use pre-indictment, whether it's a diversion program or creating programs like our STRIDE program, which is called stands for Stopping Trends of Incarceration through Diversion and Education. And we are diverting offenses that normally would not be diverted. I have a felony-only prosecution office. And so the people that come into my office are not charged with misdemeanor crimes. They're charged with felonies where the outcomes can affect their ability to get school loans, housing, the right to vote, the right to have a firearm, the most serious kind of loss of civil liberties. And so we aim to say, are there issues that we can address outside the system so that we don't have to continue to have people come into the system? And this is not a problem that can be solved by prosecution. It's not a problem that can be solved by police alone. We have to join with our stakeholders to figure out ways to solve these problems. And it means being collaboratively engaged, and it means trying to understand the deep systemic issues that exist in the communities we serve and the folks that come through the criminal justice system.
Thank you for that overview, DA Boston. I'd like to turn to you, Andre, about, I should say, Mr. Ward, building off of the DA's description, you could perhaps talk from your perspective of how over-reliance on the criminal legal system has impacted people who've been caught up in the process.
Yeah, again, thank you so much for having me. And obviously listening to DA Boston and her words obviously makes me reflect and think on how did we get here in our over-reliance on punishment, right, and incarceration. And the idea of really using criminal legal tools to solve social problems. And I think it's a real challenge for us. And I think it's something that we really have to begin to face. And just to kind of some backdrop, you know, I'm kind of a numbers person too sometimes. And I think about like 1 out of 100 people are incarcerated in this country, right? America comprises 5% of the world's population, yet incarcerates 25% of the world's population. And it's a real issue, right? There's, you know, a study that was done by the Pew Center said that over $60 billion is spent on corrections within the state and federal system, right? And that's alarming, right? When you think about the amount of money that we use to build and construct and maintain and sustain operations within facilities, right, really speaks to like the kind of neglect that happens in the communities where resources are much more needed. And so our over-reliance, I think, on incarceration has had deleterious effects on people. It creates lifelong barriers for people oftentimes to get access to opportunities within society, in areas of employment and housing, in other areas. And I think this over-reliance really speaks to the idea of what we need to begin to do. And I think DA Boston has obviously approached this in an innovative way, looking at alternative to incarceration programs, et cetera. At the Fortune Society, we also have alternative to incarceration programs that we offer to support people coming home. But over-reliance on incarceration not only impacts just the people that are incarcerated, but also the families and communities from which they come. And I think that we have to begin to look at better empowering the communities that are most impacted by incarceration so as to reduce the idea of incarceration altogether.
Thank you for that. And you read my mind. I was going to ask you what the Fortune Society has been doing. If there's anything more, you know, specific you want to talk about in terms of the programs that you're providing for people coming home would be really great.
Yeah, sure. And so the Fortune Society has been around for over 50 years. We serve over 9,000 people annually. There are 12 domains to which people can go to in terms of our service provision. And so that's ranging from alternatives to incarceration, our licensed mental health clinic, to employment and education, to food services for those who are food insecure, to family services. Also, we're talking about mental health issues. And I think that our robust service provision allows for people to get this kind of holistic kind of engagement when they walk through our doors. It's critically important when people are released from prison to be able to land somewhere where they're in a community of people concerned about their transformation and development and the possibility of them living a life of contribution. And at the Fortune Society, we offer that space. Over half of the people that are employed at Fortune are formerly incarcerated. Over half of Fortune's executive leadership is formerly incarcerated, which really speaks to us living our mission, and that's building people and not prisons. And so all of our service provision in our 12 domains really empowers a person as they come into our space. And we're grateful to be in that kind of role to be able to do that work. And we have our direct service provision, and we also have our policy work that I'm responsible for leading, because we know that each of those things are interconnected. You can't have sustainable programming, you can't impact the reliance on incarceration without having some policy work being done. And so that's an overview of like what the Fortune Society does in a real succinct way. And that's what people have access to when they come through our doors.
Thank you for that. Dr. Heller, I wanted to ask you as a public health practitioner, when you hear criminal justice actors talk about public health approaches to criminal justice issues, what do you see as the biggest areas of need and opportunities for these two systems or fields to work together?
Thank you, Alissa, and thank you for having me as part of this esteemed panel today. I think, interesting question. I think first of all, we welcome criminal justice actors talking about taking a public health approach. I think, we public health people, we want everybody to recognize that for us, everything is public health. So we welcome everybody into the fold of this kind of thinking. I think, when you just begin from health perspective, understanding what the needs or thinking about needs in the criminal justice system, we can see, I think, quite clearly that we have a pooling of health problems, as DA Boston and Mr. Ward have both referenced. We see health problems show up in the criminal justice system quite clearly and, much disproportionately higher than we see in the general population. Physical health issues are higher among people who are caught up in the criminal justice system, such as chronic health conditions, hypertension, asthma, arthritis, diabetes. We see a higher prevalence of infectious disease, such as hepatitis, HIV. I think the experience with COVID that we just went through, we see how the criminal justice system itself, in particular incarceration, jails and prisons, are actually vectors or settings for increased infectious disease. Psychological health, as we've heard, I think, several times over, for sure, substance use disorder is extraordinarily high in folks who are justice involved, and should signal to us that we are doing something wrong if we continue to treat drug use and people who use drugs as criminals when we're also in the same breath talking about this issue as a health problem. And we know that mental health issues come along with substance use quite often, especially depression and anxiety. And then finally, I know we hear often about serious mental illness and folks with serious mental illness getting caught up in the criminal justice system. Because we haven't got a crisis response that is actually recognizing mental health or mental, psychotic breaks as mental health, as health issues rather than crimes or, instances where we need a criminal justice response. More broadly, I think recognizing that public health sees, as I mentioned, all things as health. So social health is part of public health, economic insecurity, housing insecurity, food insecurity, all of these needs that have been referenced by DA Boston and Mr. Ward. And families are affected when somebody in the family is incarcerated. So family health is affected, economically, housing, employment, access to resources, the experience of children with incarcerated parents and the psychological impact, as well as the impact on their living conditions. So there's plenty of need, I think, and I would welcome criminal justice actors into helping to address that from their role. I think really the big view is to view health as a justice issue and to recognize that, in health, we've been talking a lot about racial equity, I think, especially over the past decade or so. Public health has come to recognize that racial disparities, which we've talked about for years, are actually driven by problems of equity. And so we need to focus there. We need to focus, as we talked about, on the source or the cause rather than the symptoms. And so racial equity is racial justice. And bringing, I think, the criminal justice system into, or criminal justice actors into that thinking can help to identify all the opportunities for intervention through the system, as DA Boston's talking about the models that she's stood up in the courtroom or through the courtroom. There are plenty of opportunities, I think, for engagement and redirection away from the criminal justice system or away from punishment and towards a health response. Fortune Society is an example of an organization that has long-standing alternative models. So I think there's lots of opportunities for public health and bringing criminal justice into a public health view, I think.
Yes, and I think, you definitely touched on the impact of COVID. DA Boston, maybe you can talk about how COVID and the pandemic has changed your thinking, I mean, if it has at all, in terms of your role in your work and the intersection of public health and our legal system.
So COVID really is an example that really, I think, forced, and if it didn't, it should force prosecution and courthouse stakeholders an opportunity to really think about how we can do things differently. Because the truth of the matter is, the shutdown of our court system that we experienced during this pandemic nationwide is something that the criminal justice system has never in its history experienced in this way. And so it has forced everyone to think about, I mean, you saw instantly in this, all of a sudden, there were folks that could be released from jail to no, huge consequence. The idea that we know that a court system that's backlogged has to address the most serious offenses and forces you now to really take a look at less on nonviolent offenses and ask yourself, what level of prosecution, what level of incarceration is even necessary. So the good side to the pandemic, if we can find good, we've got to find good in everything, is that I think what we are realizing is that the criminal justice system has to do something differently than it's doing. But more importantly, what are the things that we can learn from this that we can hang on to and hold on to as we move forward? We don't have to create temporary policies that are just meant to get us through this backlog, right? For the next few years where we're going to try to restart the system. But what I'm hoping for and what we're looking for in my office, and I think other prosecutors that are reform-minded are looking at, is what are things that I can implement now that people understand are necessary to move us through this time. But ultimately, I can show that if we do these things, the world is not going to end, right? Crime is not going to be over the moon. Like this idea that we can't have compassion, that we can't implement policies that make sense, that best serve our community without some lack of support for victims is a ridiculous notion, but you're seeing it in play now. And so I hope that what happens out of COVID is that it gets us out of the mindset of doing what we've always done because that's the way that it's always been done. It's an opportunity to reimagine it better because we have to, but hold on to that because we want to, and we want to achieve different results. And I think most offices are going to have to do that in order to really address what needs to happen, which is people that have been incarcerated for the last year with no hearings, no trials in many circumstances, no grand juries to review their cases. And so now those very serious offenses we have to address, but at the same time, because we can't juggle it all, we're going to have to create policies that make sense to deal with things that probably could have been dealt with in a different way. But the pandemic has given us an opportunity to look at the criminal justice system with a very different lens than we did in January of 2020.
Thank you. Andre and Daliah, do either of you have any thoughts on, the way the pandemic has changed things from your perspective, especially related to the justice system?
I'll go to let Daliah go and I'll follow up.
I was going to say, you go ahead. Okay.
To be clear to the audience, I actually had originally only had in mind DA Boston to answer this question. So I'm putting the other two a little bit on the spot, but I do think the pandemic, it's been weighing on all of us so much that I feel like we definitely want to hear your perspectives.
Absolutely.
Go ahead, Andre.
Yeah, I think that, thank you very much, Daliah. I appreciate that. And I think that, one of the things that this national public health crises in the form of the pandemic has taught us is that, you know, as a country, we prioritize what seems to be the most important to us, something that's impacting us in a really serious way. And there's been a tremendous amount of loss of life owing to the pandemic in the country. And it's a crisis.
Oh, Andre.
Yes.
Sorry, you cut off for a second. You said it was a crisis, and then we lost you for a minute.
Yeah, my internet has been unstable. Do you hear me now?
Yeah, we're all right.
Yeah, and so it's a crisis. And from the data that I read off earlier, and studies and research also suggest that incarceration puts our country in a crisis as well. And just like we responded as a country over time with the resources and money and supports necessary to aid people during this crisis, I think there also has to be a similar focus on incarceration, right? How do we reduce reliance on incarceration? What monies do we need, right, and resources do we need to really put out there to empower communities so that the people who are coming from those communities, the prisons, don't have to go to prison anymore because there are resources and supports. So I think that one thing this pandemic has taught me, at least, is that the priorities that we want to focus on, we do. And what we don't prioritize, we don't really look at necessarily. But people that are incarcerated now are also a priority, right? Right now, in many prisons throughout the United States, people aren't able to access PPEs necessarily. People aren't able to be prioritized to get vaccinations necessarily, although there's some movement there, but it's still not enough. For example, in New York State, they are issuing out vaccinations to people that are 65 years and older. Yet, there are people that are younger. People generally should also be prioritized to have access to vaccinations. And then you have the idea of the security personnel, the correctional officers there, right? Not necessarily wearing masks in some instances. And so there also has to be a focus on like what's happening in the prisons and jails. We have to prioritize making sure that people have access to the same thing that people have access to into society, so that this way, when people are coming out, right, they're well prepared, they're healthier, at least for the most part, and they can live sustainable lives. So I think, you know, COVID-19 has really taught us some things. And I think that we have to begin to prioritize reducing reliance on incarceration just as much as we're prioritizing making sure everyone gets vaccines. And I'll turn it to Daliah.
Thanks, Andre. Yeah, and just to reiterate, I think what Andre is saying, people who are incarcerated are part of the community. I think, you know, and I mean, at the most fundamental level, just if we think about layers of it, you know, experience in COVID and incarceration, I think, you know, jails, jails, we shouldn't have jails at all in our society. Jails essentially are detention centers, and they are a pool of health risk. I think one study that I talked a lot about last year, because I was so moved by it when it came out, it really articulated to me what was happening and how people who are incarcerated are part of the community, and yet we think of folks, once they go behind that wall, they're separate and in a different place. No, their health affects everybody's health. And there was this study that came out of Chicago that showed that 1 in 6 cases of COVID in the greater Chicago area in the springtime was connected to Cook County Jail, could be connected to somebody coming out of Cook County Jail. The point being that people move around, and incarceration does not separate people from communities, from families. In fact, jails churn people through in and out and back into communities, and that incarceration itself is a health risk. I think that we see loud and clear, whether we choose to respond as a society for folks who are in for the longer term in state and federal prisons. As DA Boston noted, we have an opportunity to release people and to note that people were released and nothing happened. And so will we learn from that? really what, a public health crisis showed us about incarceration in this country. If we didn't already see it, I think it spoke loud and clear. I hope it has an impact, and I hope it changes. Yeah, Andre, go ahead. You were going to say something.
No, I'm just made to think about, this whole public health kind of model and paradigm, right? And how like the communities are related to all of this. And I remember like yesterday we had this conversation, wonderful conversation with DA Boston and Alissa and others, and just talking about, this idea. And one person that I know talked to me about this tuberculosis kind of model and paradigm, wherein, you have a community, right, that there's a certain infection happening there. And the idea is those who are infected, you pull them out of that environment, you place them somewhere, and you place them there to treat them for their condition, right? But if the treatment is not happening in the environment that you pull them from and contain them there, then they go back to an infected, number one, and reinfected, because the environment is where they got infected to begin with. And I think that we have to kind of sometimes like look at that paradigm, right? That the environments and communities from which people come that are incarcerated, particularly Black and brown folk, are underserved communities, under-resourced communities, and frankly, right, are functioning within racist kind of systems, right, in that way. And so it's that kind of environment, right, is unhealthy to begin with. So people have a certain psychology and a certain behavior that follows that's unhealthy. And then you pull them out and put them somewhere, and you don't treat that by the kind of programming that's needed in prisons, the kind of treatment and humanity kind of way of treatment in prisons. And then you return them back to an infected area. So this cycle of recidivism continues over and over again, because we're not dealing with the root causes of why people, and someone referenced that earlier, I think DA Boston or Daliah, in terms of like looking at the causes rather than just the effects. So I just wanted to add that, Alissa and others.
So I wanted to add one other aspect to this conversation, just from my perspective of how I've seen the criminal justice system evolve during this pandemic and what it's been forced to do because of our inability to be together. And, we spend a lot of time talking about releasing people from jail, and obviously the public health crisis that exists and the conditions in many jails across our country when we're talking about a public health crisis where being in close quarters is, the way that you get sick and ill and essentially can die. I think the other thing we need to talk about, though, that I've seen in evolution in the criminal justice system is the whole swath of people that are within our system on the outside, those that are under mass supervision and those that are participating in programs and have to report to the court system. One of the things that we have seen drastically change because of the pandemic is meeting people where they are. Normally in the criminal justice system, to avail yourself of these types of programs, whether it's accountability courts or diversion or being on probation where you have to show up every week, we have now evolved, because we had to, in a system that allows people to report via Zoom or WebEx. And I think we need to continue to imagine moving forward, is there any reason that we can't continue to make a part of your reporting system be through video technology that we all now have become accustomed to using to sustain our life? Because we now no longer have to pull people out of work, having to find childcare, having to perhaps get on multiple forms of public transportation to make your way across town to meet with a probation officer, all things that are disruptive to success in your family and your job success. And so I think that's another area where I think we can evolve. We've seen it can work. It's not the be all end all if someone is not physically there in person. We have established that there is legitimacy in reporting and or checking in if need be through the technology that we're using right now. So I hope that we look at all the different ways that we can meet people where they are and offer them opportunities without having to saddle people with additional hurdles in order to avail themselves of programs and the court system.
Thank you. We have a question in the chat that I think touches on what DA Boston just said. And I think the question ultimately is, have you seen any opportunities either locally, say in DeKalb County, or Andre and Daliah elsewhere, for change that you think might actually stay in place? So, you know, for you, DA Boston, I'm wondering, does it seem like corrections or probation is open at this point to keeping some of these virtual calls, or is it something, as far as you can tell, that they're resisting? So we'll start with you, DA Boston, since you brought up that great example of probation, and then Andre and Daliah will follow up with you.
I think in true candor, it's probably too soon to tell. I certainly can't speak for probation or the judicial or judges who will ultimately make the decision on what they do. But I can speak for myself and tell you that prior to the pandemic, all of our diversion programs were in-person programs. And we migrated our programs to virtual so that we could continue to offer these opportunities during the pandemic. But I can tell you that some of the things that we have implemented during COVID, we decided we're not going back. We certainly recognize that there are some things, and I think we all know this from being in a world where we haven't been able to hug the ones we love and just have that physical touch, that physical being together physically in certain circumstances is beneficial to all of us. But to that end, some of the things that we've decided to do by making our program virtual, we have found it is successful. So that we could do pieces of our program virtually so that more participants could be involved and that we wouldn't be a barrier to completing that program. And then, we have thought about things, some of the things that we had in place, like during COVID, we suspended some of our administrative fees associated with our programs because we realized that there was a large level of unemployment. And it forced me to say, well, if we can do that now, why can't we do it forever? And so we've made the decision that there's no need to impose any non-mandated administrative costs for programming moving forward. If I can do the program over this pandemic and sustain it with, other utilizing other funds for costs, why can't I do that forever? Well, guess what? My name's on the door. I'm the district attorney. Of course I can. So it's that type of things that we need to continue to question what we're doing now to get us through the pandemic, and why aren't those policies things that we maintain if it is for the betterment of the community, meeting them where they are and being a part of the solution and not creating barriers to access to the things that we're trying to do.
Thank you, Andre and Daliah. Any trends that you've noticed, optimistically of changes that you think there are rumblings may actually stick around past the pandemic, or is it far too early to tell?
I mean, I think it's still a bit too early to tell. I will say that I'm concerned that where I think we did see to some degree a decline in custodial arrests for low level, misdemeanor type charges, we see now kind of a creep back up. So jail populations went down and they're starting to creep back up, unfortunately. So I wish I could say that we learned something. I feel like the conversation has to be put forward quite clearly, really, to say, and I think this is also speaking to the question in the chat from Mark, of really recognizing that health is safety, and health is the safety of everyone. And so in the same way that, maybe the criminal legal system is developed to think that we remove people who are a potential safety risk to the community from the community, and therefore the community is safer, actually to turn that on its head now and to say that safety is keeping people in communities, because community health includes everyone and has to necessarily, because we see so much how the health risks of involvement in the criminal legal system actually become health risks for everyone. So unfortunately, I can't say that that's necessarily out there yet, but we need to keep pushing that experience so that people recognize the opportunity.
Yeah, I also agree with Daliah. I think it's a bit premature to see like what's happening out there. We should sit and wait, but also be in action to push to ensure that the kind of transformation and changes that we want to see actually happens. And as Daliah mentioned, and she referenced the idea there's been an uptick in people going into jails. There's also been an uptick in people being put back in jails because of technical parole violations, right? And that's a real serious issue too, right? So the sanction of incarcerating someone for a technical violation, something as minor as breaking a curfew or having relapse, which is more of a substance use issue than a criminal like act. I think those are some of the things we have to look at too, right? There are other innovative ways that people can be engaged, right, while on parole. I know the idea of now engaging a parole officer through webinar, through Zoom, etc., has value. But what about like incentivizing that experience, right, where people are let off of parole earlier? And I know there's several bills that are out there. You have the less is more bill. You also have the elder parole bill and the fair and timely parole bill that addresses some of these things. So I just wanted to add some of that context around parole and the parole violations that are occurring and the impact it has on people.
Thank you. So some room to be optimistic, but a long way to go, and a bit premature perhaps as to what's going to stick from the early COVID months, and what might not stay within our practice. I'm wondering what the three of you view as the most important or perhaps interesting innovations in prosecutions that you've seen borrowed from public health approaches to crime, and specifically violent crime, because I think there is a growing consensus that nonviolent low-level crimes should be dealt with in a much less punitive way. But of course, the really difficult call for prosecutors is what to do with violent crime, where people are especially physically harmed. So I don't know what order we want to go in, if somebody wants to jump in. Otherwise, I might start with DA Boston, since I think she spoke the earliest in this round. If you don't mind, DA Boston.
Not at all. So, I mean, I think, I actually just kind of came out of a conversation with my team on this yesterday, as we are meeting internally to discuss, and again, my office is a felony only office. So for me, when I think of what I'm working on, some of my counterparts across the country are running offices where they handle both the misdemeanors and the felonies. And so I think it's that natural first step to say, oh, well, I can take all of these misdemeanor cases and do something with them, and then I can prosecute my felonies, right? For me in my office, that is never the discussion, because there is a completely other prosecution office that handles the misdemeanors in Georgia. So the only thing on my plate is felonies, which has given us an opportunity to be forced into looking, how do we address crimes that people do consider serious and oftentimes violent, and oftentimes there is a victim on the other side that is looking to be made whole or wants retribution. And so, it's forced us to really dig into examining individual crimes and what that means and what that looks like, and what things you should consider and what things you kind of have to set aside, even when there is a victim, for the pursuit of justice and fairness. And I wish I had an easy answer, and I don't. If I did, I'd bottle up, sell it, and I would not be here. I'd be selling it to everybody in America. I'd be a rich woman. But having said that, we have in my policy discussions just yesterday, as we're looking at cases that we are making policy decisions to treat differently than we did pre-COVID and sustain that, we are talking about offenses like burglary. We are talking about how we handle cases of robbery. We are talking about how we handle cases of armed robbery. All types of offenses. And then, you know, obviously there's always the drug conversation. There's theft. And I'm kind of pulling my list over from my notes yesterday. But these are all kinds of things that people assume should be prosecuted. And we're trying to take that conversation out and say, as a felony only office, there are some things we have to prosecute, obviously. Murder, rape, child molestation, violent crimes like aggravated assault, shootings, stabbings, family violence, battery in the home. There are a lot of things that do have to make its way through the court system to protect victims. But then there are a lot of felony cases that really, if you take a step back, even the ones that sound bad, like burglary, right? That there are some pressure points there that you can look at and say, is there a way to deal with these offenses and the people that are alleged to have committed these offenses in a way that we can help move those folks out of the criminal justice system? And so I just think it takes conversations and it takes digging in deep. And that's one of the things we're trying to do, is dig in deep to really felony cases, because that's where people are losing a large majority of their rights. Felony convictions, not that misdemeanor convictions aren't a big deal, because they are, but certainly we know the ramifications of felony convictions leads to a severe loss of rights that are critical to success and growth. And we want to make sure that we're not being a barrier to success and growth.
Thank you, DA Boston, for telling us how your office is really trying to balance those two needs for giving people second chances and reducing the impact, but also the flip side of that, which is how do we deal with violent crime? And especially when you have a victim who's saying they want justice, which in their mind might mean incarceration, right? Andre and Daliah, we have 3 minutes left. So I'm wondering if one of you has a closing thought related to violent crime in the context of how public health and law enforcement and the criminal justice system all sort of intersect. Either of you can give us the closing word, or both if you both speak fast, perhaps.
All right, I'll speak very fast so Daliah has the last word. And so,
apologies for the rush.
No worries. But I think, again, there are alternative models that are out there that demonstrate how we can reimagine engaging people who have some violent felony convictions. I know in Brooklyn, DA Gonzalez supports one program where I used to work, Common Justice, for example, which is the first alternative to incarceration victim services program in the country. And the model is unique, right? In that, you know, even the language we use to describe people, right? We don't say like victim and perpetrator, right? We say people who have been harmed and those who are responsible for causing the harm. Even that language is humanizing and even healing to some degree and empowering. And invariably, some data even suggests that many people that are harmed oftentimes don't want people to be in prison or jail. They want to meet with people and they want to understand, like, why did you do that to me in many, many cases? And so using restorative justice kind of models to engage people who are involved in acts where they harm others, I think is also important. I think that's a model that can be looked at as well. Daliah?
Last word, really quick. I easily, of course, was going to go to also noting the cure violence model, which has kind of grown, I think, and expanded around the country. But the idea of intervening, viewing a violent event as a trauma response and intervening to prevent a sort of cycle or chain of trauma responses to that violent event, and both working with the individual who caused the harm and the individuals who have been harmed to prevent further violence from the incident. So, I mean, I think we've seen plenty of that around the country, and it's sort of based on an idea that comes from public health, or could be said to come from public health, of infectious disease, of seeing violence as also a potentially infectious disease that travels through community, and that we can intervene and prevent it from continuing by addressing the people in the communities in their contexts to prevent further harm. Last word.
That was a perfect last word, and a great place to end the conversation. So I want to thank our panelists for being here and giving us the time, and for the conference for hosting us and making this conversation possible. And if anybody has any further questions, you can find our website, prosecution.org. You can email us, and we're happy to follow up with any questions that may not have been answered during this conversation. But until the next time, thank you all very much for attending. Bye, everybody.
Thank you. Bye-bye.